Hi, this is Dr. Nick from the ECG Academy, and you're thinking, "Blech, what is that? It's a brain." And we're talking about the heart and ECGs and heart rhythms, and why is he showing us brains? Is that to show how smart he is? No, I'm just teasing. Well, we're going to have to talk about the brain a little bit because the heart and the brain do talk to each other, and it can affect the ECG. And that's what this lesson is all about. It's called Sinus Arrhythmia. What we're going to do is start with a guy and a brain, and we're going to add part of the nervous system that controls all the bodily functions. This part of the nervous system is called the autonomic nervous system. Now, the autonomic nervous system is kind of like the body's autopilot. The autonomic nervous system controls all the bodily functions, the so-called involuntary nervous system, because it sends signals to all the organs and controls kind of everything on the inside. The sympathetic nervous system is kind of like the fight or flight reflex. It gets activated when you get scared or you get angry or you're in a fight with your boyfriend or girlfriend. And these signals go down the spinal cord and they create connections in the thoracic ganglia and send signals out to all the organs, your liver and your spleen and your intestines and everything. But look at that. The heart is in there someplace, and you need to know that the autonomic nervous system can control the heart. The heart is a team player, and it takes signals from the autonomic nervous system to speed up and slow down whenever the body needs it. This is the sympathetic nervous system, but I have here also the parasympathetic nervous system. Now, the parasympathetic nervous system is like the brakes. It slows things down. The signals go out the 10th cranial nerve, which is the vagus nerve, and those signals spread to the lungs and to the internal organs and the skin, but especially the heart. The heart has a lot of vagal receptors. By the way, the other name for this part of the autonomic nervous system is the parasympathetic nervous system, as opposed to the adrenaline-mediated sympathetic nervous system, which is the fight or flight reflex. Okay, so the idea here is that the heart responds to signals from the nervous system. And the nervous system is constantly changing. The sympathetic nervous system, which kind of speeds things up, and the parasympathetic nervous system that kind of slows things down, are always in a kind of a balance, a yin and a yang. So depending upon your body's needs, your organs will respond accordingly. Now, how does this all tie in with the heart rhythm? If you look at an ECG, what you'll often see in someone here, let's just kind of go over this ECG, okay? We have here a heart rate, if we measure it from this beat, of 300, 150, 175, about 70 to 72 beats per minute right here. The P waves are up in 1, and they're up in AVF. And I don't see any other P waves. It's the only one. The PR interval is normal, about 150 milliseconds. QRS looks fine. The QT looks good. So this is a normal sinus rhythm. The thing is, though, that if you take out your trusty pair of calipers and you decide to map around and see what the heart rate is doing, that if you look at the very next beat, it's changed. That's right. If you measure the next beat over, if we take our calipers and we stretch them out so that it encompasses those two beats. And then what you do is you pick up the point and you put it down here on this heavy line. And then you count off 300, 150, 175, 60. It looks like 64. So how did the heart rate go from 72 beats per minute to 64 beats per minute? And then if you look carefully, it kind of speeds up again, and then it slows down again. And then it kind of speeds up. And look, over here, it's even faster. 300, 150, 175. It's like 85 beats a minute here. So the heart rate seems to be changing constantly. And this is known as sinus arrhythmia. It's a normal finding. It happens in normal people, especially young people whose parasympathetic nervous systems are kind of like very active. The vagus nerve has this very acute, very rapid effect on the heart rate, on the sinus rate. So it's able to affect the sinus node even on a beat-to-beat basis. And the most common thing that influences the vagal tone is actually respirations. And you can often see a pattern that varies with respirations. You can see right here it kind of slows down and then it kind of speeds up again. And here it's faster, so it's faster and then slower and then faster again. And so you see the heart rate is varying with the patient's respirations, with their breathing. Okay, so this is a very common finding, and you need to be able to recognize it because there are other things that can almost kind of look like this. Now, let me show you some more examples of this. Okay, this is another patient. Okay, so what you see here are upright P waves, N1 and AVF. The PR interval looks physiologic. It looks like it's within the normal limits. You can go measure it if you are really that interested. The heart rate here in this tracing, you can see it varies. So here's a short interval. Remember, look at the forest, and you can see that it's varying. You have to kind of train your eye to look at the big picture. It almost seems like it slows down right in here, and then it gets faster again over here. Again, with respiratory variation, you have rates between about 78 beats per minute at the fastest, and at the slowest here, it's about 300, 150, 175, about 70. So it varies between 70 and 78. You can usually see anywhere from a 10 to 20 beat per minute increase and decrease fluctuations in heart rate. And it's cyclical. So this is all normal, and you have to be able to recognize it. But it is an electrocardiographic diagnosis, sinus arrhythmia. We see it quite often. Now, here's a little quiz. Now that we're kind of at the end of the introduction to rhythm analysis and the sinus rhythm, I want you to take a look at this ECG strip, okay? And tell me what the rhythm is. Come on, I'm waiting. Well, you should first realize that there's a mistake here. The first mistake, obviously, is that you are trying to read the rhythm in AVL. And if you have a normal sinus rhythm that's traveling down into the patient's left, then AVL is usually the worst lead to look for P waves. Okay, so is there a P wave or isn't there? Is this Memorex or not? I don't know. But now I'm going to show you the whole 12-lead EKG. Okay, now here's the rhythm strip that we were just looking at in AVL, and you see there's nothing there. You can't see a darn P wave anywhere. But if you kind of glance down to AVF, now it looks like there is a little bit of a bump there. But remember that P waves are not always really huge and juicy. You have to understand that they don't always look like the textbook. That's why I'm trying to introduce you to the idea that not all ECGs look alike. And in this case, the biggest P wave is probably here in lead 2, but it's still tiny. You can barely see it. The other thing is that there's a marked sinus arrhythmia here. Look at how it's kind of fast, and then it really slows down in here, and then it really speeds up again. But again, these are gradual changes in heart rate. This is typical of sinus arrhythmia. Since the vagus nerve slows things down, what you have is a very low vagal tone right here where the heart is fast, and then the vagal tone increases, and that makes the heart rate slow down. And then the vagus tone is relieved by changes in respiration, and then you get this subsequent increase in heart rate and so forth. So with the changes in vagus nerve activity, you get abrupt changes in heart rate, but not too abrupt. Okay, you have to remember that if you have the heart rate going along, and then suddenly it goes really fast, that sudden change in heart rate is more indicative of some kind of arrhythmia, whereas the sinus node has gradual changes in heart rate, usually no more than about 20% of the cycle length change in any one beat. Now, I would consider this a marked sinus arrhythmia. This is pretty obvious. It's exaggerated. It's more than you'd see under normal circumstances. So keep that in mind when you're looking at some of these strips. But the point of this EKG is that P waves can be very small, and sometimes you don't even see them. You really have to look at multiple leads to be able to pick them up And that's why it's important to, if you don't see P waves on a monitor, change the lead. And when you're examining a 12-lead ECG, look at the whole picture, look at everything, and look for P waves in multiple leads. You can see here they're pretty nicely in V1. That's another thing. V1 is a pretty good lead to look for P waves if you don't see anything. And we're going to go into this in a lot more detail when we get into some of the atrial arrhythmias that you can see. So that concludes our discussion of sinus rhythm and its variants. And in later sections, we're going to talk about arrhythmia mechanisms and then get into more detail about what can go wrong with the sinus node and how do you recognize abnormal sinus rhythms. So for the ECG Academy, this is Dr. Nick. Thanks for watching.